Hi, my name is Abby. Today I'm going to be talking a little bit about the process and the protocol for milking cows and why it's important. Our first step is to clean the entire udders. So we're going to use a hot, soapy, wrung out towel. We want it to be wrung out. We do not want it to be soaking wet because then dirty water can drip into milking equipment and that is not good. So we're going to clean the entire udders. Then we're going to do the pre-stripping, which is taking about 3 to 5 squirts of milk. For the cow, this sends signals to the brain releasing oxytocin, which will then say, okay, let down milk, and the sphincter will open up and relax, and then milk can flow out of the teat accordingly. In the pre-stripping, we can look for any abnormalities such as blood, clumping, stringiness, anything that is out of the normal. We can detect at this point and treat accordingly. The next thing we're going to do is a pre-dip of a teat dip. A teat dip is basically an antibacterial, such as like iodine. If it is going to be iodine, we want it to be 0.5% or less iodine in the teat dip. We do not want too much iodine content in our milk. We also can look for 10 to 14% of skin moisturizer for chapping teats, because that's a no-go. And when we do the pre-dip, we can use a cup, which basically goes over the teat. And it's preferably used just because the teat dip has a dye in it, so you can see the full coverage of what is covered in killing germs. So we're going to leave that on for 30 to 60 seconds, and then we're going to use a single-use towel that can be paper or washable, and we're going to wipe that down and clean that off. Then we're going to apply the milking machine. We want to apply the milking machine rather quickly because once the letdown happens, the sphincter relaxes and opens up. If we don't apply the milking machine in an appropriate amount of time, the sphincter will start to tighten up, and then the milking machine can cause trauma to the orifice, and which can lead to somatic cell increase and vulnerability to mastitis. And mastitis is an udder infection that is potentially fatal, and you can detect the symptoms by swelling, hardening of the udders, watery milk appearance, flakes, and clots. And so these are symptoms that you can look for. They're very dangerous, and that's something we want to avoid. So when we apply the milking machines, we want to check for the correct vacuum pressure, and we want to make sure that there isn't any slipping. We want to make sure they're sectioned on there pretty good, not like slipping off. So the next thing we want to do is the teat dip, which will be the post dip. And then this is basically going to cover back up the teat and wait for the orifice to tighten back up so no germs can get into the teat. So basically, yeah, it's just trying to keep it out so no mastitis is happening. So thanks for watching. I hope you found some of this interesting.